Howdy folks, Dr. Z returning again for VEDA 2014, Day 6. The last couple of videos have been released a little later than I wanted, but I still got them out with decent production. Today, I'm just going to talk rather than be behind the camera. Tomorrow I'll do a regular video with my beautiful face. But today, we're talking about health system pharmacy. So the flip side of community pharmacy is the kind that focuses on patients in hospitals. First, let's say you're sick, way too sick to wait for your doctor. You end up in the emergency room, followed by being admitted onto a floor, and boom, you have pneumonia. Well, the doctors, the nurses, and the pharmacists will do what they can to make you feel better, and to get you out the door as fast as they can. So you remember the breakdown of what a prescription was last time? Now that's called an order, one your doctor writes. Your nurse scans in, and your pharmacist follows. Now, the pharmacists are mostly stationed in a pharmacy, usually in the basements of hospitals far away from many patients to see. And they usually have access to tubing equipment to send any emergency orders to the various floors, just like you'd see at a bank or community pharmacy drive-thru. In there, all of the medications are prepared and sent up to the floors. Medications can be like those you find at a community pharmacy, tablets, liquids, whatever it may be. But sometimes patients will need injectable medications that need to be prepared in the cleanest of environments. You've seen these on TV, like IVs and other weirdly colored medications that they go right into your arm. But basically, a lot of the workflow that I explained in the last video is similar to that in a hospital pharmacy. But there are some major differences that you probably won't see in a community. One major trend that seems to be growing by the day is the increasing need for clinical pharmacists. We pharmacists are all trained to know about many disease states and also keep in touch on the latest in medication guidelines. But clinical pharmacists take it an extra step and provide one-on-one consultations with nurses and doctors, and become a necessary part of the treatment team. On top of consultations with medical staff, they are also key in training patients on what's needed in the community, such as describing what medications they're discharged with and how to take them, as well as many other monitoring skills they'll need to make sure they don't return to the hospital. It is also the pharmacy's responsibility to maintain what are essentially mini pharmacies that automate the dispensing of medications closer to the floors than from the basement. These machines act like the automatons that some community pharmacies use, but are usually self-contained and accessed primarily by nurses who grab medications for patients as needed. Another difference in the dispensing is that most medications are unit dosed, or only given as needed for the day. Since we don't want to keep patients longer than they need to, their medications are only prepared each day they stay. This is different from the community, where we usually prepare medications for the following 1 to 3 months. Pharmacists are part of a committee called P&T, or Pharmacy and Therapeutics. There, they analyze outcomes of patients in and out of the hospital, as well as the costs associated with them. They research into the latest evidence and create a list of medications the pharmacy should carry based on cost effectiveness. This committee not only saves the hospital money, but also the patients, since medications can cost up to half of their bill when they leave. Health system pharmacists are a special breed of pharmacists who continuously look out for the patients, even though they may not see them as often as community pharmacists do. Their actions help make sure that at a person's worst time in their life, that they are as comfortable as possible and treated to the best science has to offer. And that's today's video. Hit me up in the comments or on Twitter if you have any questions or follow-ups. Don't forget to like and share this video as well as my other videos if you like what you're seeing. Tomorrow, I'll talk about other areas of pharmacy, and hopefully, I'll be behind the camera just a little more. Until then, this is Dr. Z signing off until tomorrow. Bye.